morning over breakfast, and it's that particular photograph of our Queen and the Prime Minister.
Yes.
And there they are, about to shake hands.
Yeah.
They've got, in the background, they've got a lovely roaring fire.
They have, yeah.
Lights on everywhere. And I just think to myself, you would have thought somebody around them would have said, we can't have that photograph going out.
What?
Beginning of September.
What? What's the problem with the picture?
Well, it's the energy crisis we're in. I mean, I don't know many people that can afford to have their gas fire on in the beginning of September.
It's not.
Surely there should have been some sensitivities there.
Is it a gas fire or a log fire? Is it a gas fire or a log fire?
Well, it really doesn't make a great deal of difference, I don't think, because there's still energy being used, and it's the lights are on.
I hear what you say, sir, but a couple of observations. We're talking about the Queen, a 96-year-old woman. I do think it's appropriate that she has, I don't know if it's a roaring log fire or a gas fire. We're talking about a historic picture with the Prime Minister, so I do think it should be properly lit. What are you suggesting? We have the monarch standing by one bar on a gas wire, and we just illuminate it with a miner's helmet?
Well, that's not quite really what I was suggesting at all, and I think you're taking it somewhere where I didn't suggest that. All it was the sensitivities. You would have thought somebody somewhere would have said, do we necessarily have to have so many lights on? Because there'd be, you say a 90-year-old woman, 96. I can assure you there'd be 90-year-old people that won't put the fire on because they can't afford it.
You're absolutely right there, sir. I give you that, Richard. But let's see what others... Is that picture, it's front page for some of your newspapers, in virtually all of your newspapers. I suppose we could try and see if we could lift it and help you see it on lbc.co.uk, should you so desire. But hopefully I've described it. There is the 96-year-old monarch. Just give you that number again. 56 British Prime Ministers Her Majesty has met and appointed 15, and we've only had 56. Extraordinary. Long may it continue, longevity. Right, we're talking about Prime Minister. Should we talk about Deputy Prime Minister? Or even better, should we speak with a Deputy Prime Minister and say congratulations to Conservative Deputy Prime Minister and Health Secretary Thérèse Coffey, who joins me now. I'm absolutely thrilled for you. Congratulations. You must be very excited, if not challenged, by what lays ahead. Good morning.
I am excited. Of course, I was excited when Liz Truss won the leadership and subsequently became Prime Minister of our country yesterday. And I'm looking forward to supporting her as she set out on the doorsteps of Downing Street, her focus particularly on the economy, on energy and indeed the NHS.
We're going to talk about that. Now, I heard on what's called a clip, you saying the A, B, C, D of your jobs. A for ambulances, B, backlog, C, care, D, doctors and dentists. Can I add an E? Thérèse Coffey, explain how you're going to challenge those 4 issues.
Look, I'm very conscious as a constituency MP what most people enjoy, actually very good access to healthcare. Excuse me.
I hope you don't.
But I'm also very conscious that we need to make improvements and we need to make them quickly. We'll be getting into the detail of that. I'm going to meet the Chief Executive of the NHS today in my first full day in the role. While, of course, we've been working on plans, and there are plans already in place to make improvements, I'll be making sure that I get into the detail so that we can deliver for patients.
One of the most eye-catching pledges from the Prime Minister yesterday was her determination, which I'm sure you share, to allow my listeners and the good folk of Suffolk Coastal to be able to get doctors' appointments when they require them. Can I ask you, when will that be in place?
Well, I'll be looking into this in considerably more detail. Of course, doctors around the country as GPs are, in effect, independent contractors, but we need to continue to make sure that we help them in the best way that we can so that patients can get those appointments that they need for their clinical things to be assessed. This is a big challenge. We do have more people working in the NHS than ever before, but also many vacancies, and that's the sort of element where I'll be going through in detail with the Chief Executive of the NHS.
One of the big challenges, one of the early challenges that you'll face is, of course, the junior doctors. A couple of months ago, the BMA suggested a 30% pay rise, admittedly over the next number of years. Are they going to get it? Are you concerned about a doctor's strike?
Well, in terms of salaries, there was an independent pay review, and we accepted the recommendations of the independent pay review in full, and that is what we will deliver. I know that both doctors, nurses, everybody in the NHS is very focused on delivery for patients, and I'll be doing my best to support them in how they achieve that. But as I say, we've accepted the recommendations of the independent review body.
So what will you do to avert a strike then? I'm not clear on that, sorry.
Well, I hope that, of course, people will continue to put their patients first. I think that really matters, but it's not for me
But
to
if they
determine
can't pay the rent
themselves.
or they can't pay the bill at Sainsbury's or Waitrose, how should they be continuing to put patients first if they can't pay the bills?
Well, I think people will be receiving a significant package that's already been agreed, and that's through the independent pay review body, or we've accepted that recommendation. But more broadly, government has been investing in cost of living payments, not only for people on benefits, which, by the way, includes people in work as well as people out of work, but also the support that's in place for all households to help them with the cost of living.
But
So
what
there'll be more.
percentage will the junior doctors be getting?
I don't have that information to hand, Nick.
You're the health secretary, shouldn't you know that?
I went to the Department of Health yesterday at about 7 p.m. I'm seeing the Chief Executive of the NHS today.
Okay. Can we talk about other matters? It is reported that the energy support package will cost £130 billion. That will be the bigger outstrip the furlough programme from a couple of years ago. What sort of debt might that load on our grandchildren or even our great-grandchildren?
Well, the details of the energy package are my understanding is still being finalised, and it will be set out later this week. I don't have that detail to be able to answer that sort of question, but what I can say is that the Prime Minister is very alert to the need to support households, but also the need to get on with the energy supply challenges that we face, and that longer term process of getting more power stations up and running, more renewable energy. That's going to be a key focus of this government too.
Okay, so would the payment be based on perhaps additional windfall taxes or by borrowing, which obviously means my great-grandchildren will be repaying this debt? Which do you imagine it would be, Deputy Prime Minister?
Well, Nick, the details of that will be set out later this week, and that I'm afraid you'll have to wait till then.
Okay. Back to the health brief. Can you see a situation where we might rely on the private sector to try and clear the considerable backlog? Would you consider that?
Well, we've already, the NHS already uses the independent sector in order to undertake operations today. I'm conscious that we are opening up more diagnostic centres, that we're opening up more places where we can do elective surgery. That programme is well underway, and that's why the focus on backlogs is really important. I want to use every capacity that we can in this country, because what matters is the outcome for patients.
So you're happy to use additional private resources?
Well, I think we just need to use every capacity that we can, and we already use the independent sector in order to help patients get the operations that they need today.
So to clarify, we would use more private care?
Well, I'll go through in the detail of the plans of what's with my department. We haven't gone into that level of detail, but there is capacity right across the system. What is key, though, is making sure that at the moment there are thousands of people who are currently in hospital and don't clinically need to be in our acute hospitals, and that's why an important part of what we'll be doing is about how we can unlock more places for people to receive care in the community at home, or indeed in other social care settings too.
I understand you're not necessarily that keen to push about the future. Let's look at the past a little bit, if we may then, Deputy Prime Minister. The Prime Minister yesterday spoke of building an aspiration nation. Your party, in some way, shape or form, have been in power for 12 years. Why has it failed to date?
I think we do have an aspiration nation.
Why do we need to build another one then?
I think that there's an element here of recognising with what has happened with COVID and some of the kind of aspects of our challenges that we face have been exacazabated by that.
That was 3 years ago.
And we need to get growing again.
Yeah, but
it's growing the economy that really matters. Liz Truss, as Prime Minister, we'd already started on aspects of deregulation. She wants to accelerate that, in particular on things like EU retained law, but making sure that we make it as easy as possible so that not only businesses and others can get on with what needs to be done in this country, but also we have a streamlined, effective, efficient government as well in order to deliver our public services.
So that was sort of 2019, 2020, COVID kicked in. That still gives the Conservative Party 8 to 9 years to have put things right, but we still don't have an aspiration nation, though, because we need to build one now. I mean, what were the Tories doing for 8 or 9 years?
I think that we have seen significant changes since the crisis that the Labour Party left us in 2010.
Oh, I see. I'm sorry. Since the Labour Party. Sorry, go on. I'm so sorry. Go ahead. Yeah.
Since the Labour Party left us in 2010, and considerable amounts have been done to improve the prosperity of people in this country, and indeed the how we grow as a country. I'm conscious that COVID has been a real setback in that, and that's why, in terms of as we take this forward, Liz set out why she wants to get on with aspects of deregulation, I say, to make ourselves more focused on outcomes and very much reducing the cost of how we do business to be effective, not only through the private sector but through government as well, in regard to making sure that we deliver for people.
Can I ask you a question about your residences? Oh, are you all right over there? You've got a phone ringing. Are you okay? Yeah.
I've just realised my alarm is going off on my phone.
Oh, my goodness. What is the alarm
You're
for?
getting a bit of Dr. Dre. It's just an 8 o'clock alarm. Sorry.
It is Dr. Dre, is it? That's fantastic. Yeah. Well, Dr. Coffey with Dr. Dre as the health secretary, it just gets better and better, doesn't it? Can I ask a question about your residence? You'll be aware that in the past there have been situations between foreign secretaries and deputy prime ministers over the use of chevening the country estate. Will you be getting it, or will Mr. Cleverly?
Nick, what can I say? I'm not really focused on grace and favour residences. I'm just excited to become the Secretary of State for Health and Social Care. That is my top priority. I'm perfectly happy to focus on that for now rather than other matters.
And finally, some commentators have suggested that as someone who likes a cigar and possibly enjoys the odd noggin, as do I, and, let's be candid, you and I could possibly do with losing a pound or two, you're not necessarily the best example to be the Secretary of State for Health. Thérèse Coffey, how would you respond?
Well, my focus is on how we deliver for patients, and I appreciate I may not be the role model, but I'm sure that the Chief Medical Officer and others... Chief Medical Officer and others, I'm sure, will continue to be role models in that regard, and I will do my best as well.
But should someone who enjoys a smoke and a drink be the boss of the health service? I know I'd never get it.
Well, I'm the Secretary of State for Health and Social Care, and that's what I'll be focused on delivering. I appreciate, I'll probably get all sorts of comments, Nick, but nevertheless, on a more serious matter, I have been a patient of the NHS too, and I've had some brilliant experiences, and I've had some experiences where it could have been better. My focus is on patients, and that's what I'll be making sure the department focuses on too.
Best of good fortune to you. Thank you for appearing on the show. Deputy Prime Minister Thérèse Coffey appearing on LBC 2 minutes after 8. Let's get the news.
On your radio, on Global Player, and
Play LBC.
Leading Britain's conversation. This is LBC.
From Global's newsroom at 8 o'clock, in her first full day as Prime Minister,